This is Find Your Flow, a show about navigating the complexities of life and business through the lens of curiosity. I'm your host, Angelique, and I bring together experts to deliver responsibly curated conversations and perspectives that aim to progress people and the planet. The global aesthetic medicine market was valued at $99 billion in 2021 and is expected to expand at an annual growth rate of 14% by 2030. It's an amazingly vibrant, fast-growing industry that really is just scratching the surface of its potential. However, with greater success comes greater scrutiny, and medical aesthetics has begun to experience the same sort of enforcement that more established medical practices have had to deal with for many years, not to mention its own ethical impact and impact on generations to come. So today we're going to dive into the great question of just how much is enough and explore ethics, trends, and other factors impacting the industry today with a good friend of mine and somebody I've known for many, many years, board-certified plastic and reconstructive surgeon, Dr. Joseph A. Franklin. So alongside owning his own surgical practice in Cary, North Carolina, he is a fellow of the American College of Surgeons, a diplomat of the American Board of Plastic Surgery, and a member of the American Society of Plastic Surgeons. He has almost 20 years of experience, and patient safety has always been the driving force in his practice. So his focus is on creating an inclusive environment where all feel welcome with the goal of helping people reveal their best selves. And that's a mouthful, but you're quite a guy. So I'm really excited to have you here. And like I said, Dr. Franklin and I, we've worked together for almost 4 years now. I've been very fortunate to work alongside his care team in brand and brand marketing. So it's long overdue to have you on this show, but welcome. Good to have you.
Thank you very much. Yes, nice to call you a friend too.
So tell us in the audience, like more about your experience and, kick us off there.
So I started my practice a little bit unusual. I was in a level 1 trauma hospital, taught medical students, had residents occasionally with me, and a lot of my practice was trauma. So that's actually somewhat of an advantage kind of going long term because you really have to learn the anatomy if you're doing all this crazy stuff. So it made me a better surgeon. What it also did was long term, I was like, this is not the only thing that I want to do. So in order to grow a cosmetic practice, what I really had to do was decide to leave the town that I was in and move to this area of the world. So that's really kind of how things morphed into my current practice, which is probably 80% aesthetics at this point.
Yeah. And so you were able to use that experience working in trauma units, and that kind of encouraged you to start your own practice and grow that here. So we talk a lot about these trends and these shifts, and my gosh, I know that we send a lot of like, look at this, what's going on in social media. And, what are some of these trends that you're seeing right now? And I'm going to pull up the stream that we have to showcase some of these because there's a lot of these things that even younger generations are getting into. So what are we looking at here?
Right. So one of the trends which has really hit TikTok is to have buccal fat removal. That means removal of the cheek fat, which you can see in this picture of Leah Michelle. So Leah is a Broadway actress, currently featured in Funny Girls, which was made famous by Barbra Streisand. And she's a gorgeous lady to start with.
Right.
Since in the past several months, her pictures are now coming out where she's obviously had something done to her cheeks, which is okay. The problem is what we're worried about is this is not going to age well. So the loss of volume right now makes her cheeks look very sunken and very sculpted. What's going to happen long term is as we get older, we lose volume in other places in our face. So this is just not going to age well. So it looks good right now, but long term, this is going to be a little bit of a disaster to try to fix.
Right. And so like you said, she's beautiful to begin with. And that's, one of the beauties of plastic surgery and having aesthetic, wellness available to a lot of us is like, it makes us feel good. And so I think at the end of the day, if it makes you feel good, do it. But I think it's important to know what are the implications long term. And so what age range would you say that this becomes more of an issue? 40 and below?
When people start hitting their 40s. It
Yeah.
depends on volume loss too. So what happens a lot of times if people lose a lot of weight, as
Mhm.
people are morphing their weight right now with like Ozempic and things like that, people lose weight in their face first. So weight loss can also trigger it. But usually by the time you're hitting your 40s and 50s, you're really losing some significant cheek volume. And that's when this is going to become a problem because let's say if she wanted to come in and get filler or something put back in her cheeks,
Mhm.
the problem is if you want filler in this area, what will happen is you have bone that you can lay the filler down on so you can grow stuff, so you can give it volume. In this area, there's nothing to put it against. So what's going to happen is there's no way to know where the filler is going to go. Is it going to go toward the inside of her mouth or toward the skin?
Wow, that's interesting to think about for sure. And so we've got another one here, and you told me about this before, and I didn't even know that this was a thing. So I'm
Right.
excited to
So
share.
this makes me laugh. So when I was started in residency, we had this huge trend where women were wearing French cut underwear, and that's what the picture that I sent you. And this is French cut underwear. So you notice it's higher on the sides with a slightly higher waistband, and that
Mhm.
was just the trend. And this is granted been 15 years ago. So what happened after the French cut underwear? The next thing that kind of the trend was, oh no, we no longer want mom jeans, we want low rise. So 5 years down the road, people were coming to the office and saying, "Hey, can I have my scar revised so it'll fit in my low-rise jeans?"
Mhm.
So once again, this is a trend, and usually, kind of the rule of thought is don't do anything to your body that's trendy because what's going to happen? The trend will go away, and then you'll still have it surgically what you end up with.
There, right. Well, and I have to laugh because I'm starting to see this trend kind of returning too.
Oh
So
yeah,
I guess at that point, I mean, is there a happy medium where it's like, you're good if you go low rise, you're good if you go the French cut?
I think if you just do low rise, you're probably fine.
Yeah. Yeah, that makes sense. And this is one that I've been seeing a lot of in the news, unfortunately, because a lot of people are starting to go and to travel plastic surgery. So they're going to another country to have this done. And there's been some really big implications from that. Even, in some cases, death. So what's going on with the BBL? What is the butt implants?
So that everyone knows what a VBL is, and we've talked about it a bunch. But what a Brazilian butt lift is, or a VBL, is basically liposuction in one area of the body and adding that fat to your buttocks. So the fancy term for it is fat grafting. So you're stealing it from your stomach, stealing it from your legs, and putting it in your buttocks. So lots of potential good and bad with this. So the good is that if you can tell the picture that you posted, this lady has a really good result. This is not a gigantic BBL. This is fairly subtle, but it's just
Mhm.
enhances your shape. So that's perfect. Those are great results. The problem becomes when you do the really big ones because as we get older, our skin stretches. And so what's going to happen is the skin's going to get stretchier and cellulite and all this stuff, and it's just not going to look good. So there are now a lot of people who are coming in to have their BBLs reversed, which is basically doing liposuction on the BBL area to try to get it to look better. With regards to going to a foreign country for plastic surgery, a lot of people do it because it's cheaper.
Sure.
The kicker with medical tourism is complications and death. And the reason that's the problem with traveling long distances, say, for example, if you travel to Honduras, I'm just picking a place, you won't be able to see your surgeon quickly if there's a complication. So you
Mhm.
need to have someone kind of in the back door to see or in the area to see. And so that's problem number one. Number two, there's a thing called Virchow's triad, and that's a big fancy term for when right after surgery you're slightly hypercoagulable, meaning you're more likely to form a clot.
Mhm.
So the problem with that is people are more likely to form blood clots in their legs, especially if you combine that with sitting on a plane for multiple hours after a surgical procedure. So a
Yeah.
lot of these people are getting blood clots in their legs, traveling to their lungs, and they're dying. So that's why we say, hey, probably better if you stay in the United States or say somewhere close to home. Perfect
Right.
example. I have a friend who lives in Knoxville that I went to high school with. Lovely, see her every couple of years. She had lost a lot of weight and she wanted a breast lift and a tummy tuck just because of the extra skin. And I was like, thank you so much for thinking about me. Thank you for trusting me. I certainly appreciate it. That's the nicest compliment I could get, but have it done closer to home. You need to have it done somewhere where your surgeon is nearby if you have a
Mhm.
complication.
Yeah.
You would probably do great. Nothing would go on. But in the event that something happens, you need your surgeon to be close by.
Yeah. And what is that timeline? Like, how far out are you kind of in that safe zone for
A
a major
couple of
procedure
months.
like this? A couple
Yeah.
months. Yeah.
Yeah.
So if you're going to do a travel procedure like this, or even like a tummy tuck, you've got to be committed to spending
At
a good
least a
amount
month.
of time. Wow.
Yeah.
Wow.
And the other thing with BBLs is there's a great story, and it goes back to the buccal fat we were talking about a second. There was a lecture at the aesthetics meeting this year in Miami. It says when fine wine turns to vinegar. And what it was is what procedures are we performing now, which are going to go south and not going to age well. The two that were talked about the most were the buccal fat removal and the BBL, because they look good now, but they may not age well.
Right. Like you said, I mean, don't go for the trendy thing. Go for something that is, I don't know if the word's evergreen or something that's lasting, but yeah, something that ages well, if you will.
Right.
Man. Well, I'm interested to maybe, look at too. There's a lot of these procedures going on right now. Like we were saying, that aesthetic wellness and aesthetic procedures and plastic surgery is more accessible than ever. I mean, even down to financing it and, what's being portrayed in social media. But then I'm also seeing a lot of younger generations getting into it, 18 plus. So I want to talk a little bit about, the topic of body dysmorphia and ethics. And, if a patient comes to you and maybe teetering on that space, I mean, how do providers, I guess, approach that? And what would be your recommendation for others that might be, being approached by something like that?
Well, unfortunately, in this business, I think body dysmorphia is probably fairly common. To an extent, we probably all have it. We were talking about it Friday on the phone when we were both driving to separate beaches.
Right.
So, which just proves we really are friends. But what's interesting is I think it becomes apparent when someone just looks a little too much of something. If someone's completely obsessed with something that's so tiny, you're like, there's a little bit of a red flag. I turn down probably 15% of the people who come to the office for something cosmetically because I was like, I just don't think I can provide what you're looking for.
Yeah.
With that being said, the more you talk to people, the more they kind of give themselves away. And so for the people that really have really significant body dysmorphia, I just kind of step away. That's just been my practice. But, and I don't know, there's not really a great answer for it, unfortunately, about what to do.
Sure.
I just think it's better to kind of tell people like, hey, I'm a little bit worried about you, and what you're asking for is probably not going to be the best thing for me to do.
Right.
And I'm wondering if there's something else going on.
Yeah.
And that's just what I do. With regards to, we were talking about when do people start looking weird? And I think what the body dysmorphia kind of brings into it, when you can walk down the street and you look a little goofy, something's up. If you're walking down the street and you have kids turning and looking at you because your lips are too big or your cheeks are too big or your boobs are too big or whatever, you don't look pretty and enhanced and or more masculine and more whatever. You just look a little strange. We typically use the Real Housewives TV series as an example because they're all very public with their look. And I think part of the problem is if you look at, sometimes people don't know. So for example, my classic example is lips. So when we look at ourselves in the mirror, we look AP, anterior to posterior, front to back. So we see ourselves this way. When you turn to the side, you get a completely different profile. You get a completely different look at your profile. And so sometimes when people look, very big, voluptuous lips, and just by looking in the mirror, they don't see that they look a little bit like a goldfish from the side. So I think that's the kicker. So that sometimes people don't see it, or they don't see all the angles that you do when you're actually talking to somebody.
Oh, that makes a lot of sense. And I know we've talked with a lot of different, the nurse providers and NPs that we've worked with where, it's not just, yes, come in and get your lips done. It's like, it's typically like a whole aesthetic assessment. And it might start one place and then, it's a journey to get there. But I've heard a lot of, feedback from different nurses where it's like, if you come in and you have thin lips and then you want to look like Kim Kardashian, it's just not realistic. And I might not be the person to get you there. How can we safely, get you there, but also in a space where it's like, it allows you to evolve versus just 0 to 60.
Right. Well, there's a beautiful line that I love, which says plastic surgery should whisper, not scream, which just means it should be subtle. And so, we've known people that could come in for fillers or injectables, and they suddenly leave looking like a different person because of the injection.
Yeah.
I want people who just look like a better version of themselves.
Hmm.
I don't want someone who goes out looking completely different. And I'm like you. I very much let's do a little subtly over a course of time as opposed to big crazy all at once.
Yeah.
I mean, that's just been my practice, and people tend to appreciate that. And I say, hey, we can. Obviously, we're talking filler and Botox and stuff like this at this point, not surgery. But when you're doing stuff subtly, it becomes like, oh, you just look great. You look rested. You look super. What are you doing? As opposed to, woo, what did you do?
Yeah.
You look crazy.
Yeah. And some of these things, I mean, breast implants, reversible, you can remove them, but some of these, it's not. You can't exactly filler you can dissolve. Botox will, eventually melt away, but for some of these things, it's going to stick with you. So having that course of action that subtly takes you to that next point, is probably a better route, if you will. So, let's talk about maybe the types of providers so that we go to too. So with Botox, 3 months. 3 months. I know there's some products that are on the market that are lasting longer. Fillers are something that, there's a lot more dangers to. And, even like you talked about with BBL, there's a lot of different dangers that come along and medical attention that you need. So if somebody that is brand new to exploring cosmetic procedures and has had something in the back of their mind forever, what would be your recommendation or maybe top 5 questions for them to ask when they start searching for providers?
Sure. I think first and foremost is find out if they're board certified.
And what
Are
does
you
that
certified?
mean?
It just means have you been credentialed by the appropriate board? For example, there are a lot of kind of made up boards or people that just like, I'm a board certified, whatever, that really don't exist. So the easiest thing to do is go to the American Board of Medical Specialties, their website, and they'll list all the boards. So if someone comes up with something like, I'm board certified in right eye only reconstruction, that really doesn't exist. So that's the first thing to ask. Are you board certified? If they're not board certified, maybe they're just younger in their career. Are they board eligible? Meaning, are they in the process of getting everything done? So it means they're doing everything right. Maybe they just haven't been doing it that long. The second thing to really then to ask is how many of these have you done? If we're talking Botox filler, something like that. Have you done this once or have you done this, 2,000 times?
Right.
You want someone who's got a little bit more experience with these things just because you're going to get a better result because they know what works and what doesn't. Ask them what procedures they don't do, because that'll give you an
Okay.
idea. Are they super comfortable enough to say, I don't do everything? This is not Burger King, have it your way. You can't have everything. What products do you not provide?
Okay.
With regards to surgeons, you obviously want a plastic surgeon or someone who has boarded in plastic surgery. There are a couple of different ways to get to plastics. You can do ortho, neurosurgery, general surgery. There's a whole lot of different things. So just see it if they're a plastic surgeon. If you're doing injectables, dermatology does a great job as well. So just ask. There are a huge number of nurses who are great injectables with the neuromodulators like Botox, and Dysport, and Daxify. And there's nurse practitioners would do it as well as the fillers. So you just need to find someone who is well versed in what they're doing. You also want to go to somewhere where you're going to get a medical evaluation prior to your procedure. Is someone going to see you to make sure you're a candidate prior to you just going and getting whatever done?
Yeah.
For example, if you're taking a blood thinner, you may not be a candidate for even, Botox type of things. So that's where you need to be seen by a medical provider first. So if you go into someone's office, they're not necessarily board certified. They don't kind of can't tell you what they don't do. They're not completely versed in how many of these they've done. I'd kind of get up and run.
Okay. Now, there's a difference between plastic surgeons and cosmetic surgeons. Is that correct?
Yeah.
And what is that?
So that's my pet peeve. So cosmetic surgery, people will claim to have cosmetic surgery boards or boarded in cosmetic surgery. That's kind of like saying I'm boarded as a flight nurse on the Starship Enterprise. It doesn't
Okay.
exist. That is a completely made up and confabulated board. It does not exist in American Board of Medical Specialties. It's generally people who've done 3 to 6 months of extra training after whatever their initial training was, like general surgery, and then they're hanging a cosmetic surgery fellowship. So cosmetic surgery fellowships or board certified in cosmetic surgery does not exist except on paper. It is not recognized. The problem is it takes a long time to learn how to be a plastic surgeon. For example, if I am called in to do a breast augmentation, people are like, oh, that's super easy, it's boobs. You know, what I have to know though is do they have some problems with their sternum, which is going to cause the breast implants to sit weird? Do they have some congenital anomaly, like one breast is bigger than the other because maybe they are missing some muscle on one side?
Mm,
Is there, so there's a lot of things which go into something as simple sounding as a breast augmentation that other people are not trained to see and to do. So
right.
that's the reason going to a plastic surgeon, people are like, why do I need to do that? It's because we're the ones trained to do it.
Right, right. Well, and I also think about your, beginning experience working in trauma too. So if something goes wrong, well, you've got a lot of different experience that can help you and that patient, most importantly, in something
Right.
like that.
Well, the classic example for me is so when I used to do a lot of facial fractures, so people would come in after a car crash. And so they had multiple different injuries, and I would get called to fix their facial fracture. Well, even though I think I'm all that in a bag of chips, we're actually the very last people to see them. So they've got
Mm,
to have their why is their blood pressure low? Have they lost blood? That has to be evaluated. If you've got a bunch of facial fractures, there's a chance you also have a cervical spine fracture or there's something going on with your neck. So all this other stuff has to be worked up before we would do anything.
yeah.
So if I didn't have that experience, I'm gonna just take you to operating room and fix your neck while you're bleeding to death from a splenic laceration.
Whew. So research, 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 ask
Right.
questions. Those are really great. I especially liked the question of what don't you do and seeing how they respond to something like that. That's an interesting one because even psychologically, it's like, how are they open to admitting that they don't do these things? Because everyone has specialties. I mean, your specialty, you'd say blepharoplasty, breasts, and mommy makeovers.
Right. Well, I mean, classic example. So I was talking to my colleague that who's what, 3 miles away. And he was asking what I do a lot of. And I said, I do a lot of eyelids. It's just one of those things that post COVID, I just ended up doing a bunch of eyelids,
Mhm.
eyelids and boobs and Botox. Um, and he looked at me like I had four heads because he's like, I haven't seen an eyelid consult in years. And he's literally 3 miles down the road. Where on the flip side, he does a lot of body contouring after gastric bypass and a lot of the smaller Brazilian butt lifts. And I said, I haven't seen a full body contouring several months, and I have not seen a Brazilian butt lift consult a couple of years. So I
Mhm.
think practices just kind of evolve into what they're interested in.
Yeah. That makes sense. And then what they're known for, because it is such a referral based industry.
So
There's a
yeah,
lot of, having your before and afters. And, it's also really important for people to get a feel and have a personal relationship with their surgeon or any provider for that point of view. But yeah, a lot of times it's like, oh, well, where did you have your implants done? Did you like your experience? And then I think practices can start to be known for that as well. But yeah, that's so important. I mean, like you want to have good results, whatever it is. And I think Botox can be a little less, more forgiving, I should say, but a surgical procedure, you want a board certified plastic surgeon for sure.
well, and I try to tell people too, I recognize that I am very polarizing. People like me or dislike me fairly quickly because I'm just going to talk to you. I'm not going to come in with a white coat. That's just not my personality.
Yeah.
There are plastic surgeons in this town who always go to work wearing a suit. That's not my shtick. Obviously, I'm here in a t-shirt.
Mhm.
That's not what's comfortable for me. And there's some patients who really need the formality of it and some that don't. And so I recognize, I'm like, if you don't really like me or if I'm not your cup of tea, it's okay. Let's get you to somebody else. I'm fine with that. I would much rather you be happy with me
Yeah.
and we'll get you to the results you want rather than, if we just don't have good rapport.
Yeah, yeah, absolutely. And going based on the referral aspect too, I feel like, what I learned and value about, having worked with you is how collaborative the industry can be too, because you were the first to admit I do not do rhinoplasty, but I have a Rolodex of people that I'd be more than happy to send you to because of how qualified and good they are at it.
Yeah. Well, I mean, that's one of the things too. I'm probably getting a little more experience in your career. You can kind of turn down things.
Yeah.
But if there's things that you just don't enjoy doing, like I just don't enjoy doing noses. That's not my thing. So I was like, send them to somebody who loves to do it and does a great job.
Yeah. Yeah, exactly. Exactly. Well, one of the other questions I wanted to ask about is maybe some of the common misconceptions that we hear about different procedures going on today. One that's top of mind right now is the explant surgery. And, there are a lot of conversations around breast implant illness. So what are some other misconceptions, or maybe even start with breast implants?
So, kind of history. So, breast implants, kind of in the 80s, got a really bad rap. The Dow Corning implants were just kind of making a mess because the shells were terrible. So, breast implants went off the market for a number of years, except for reconstruction. They stayed on the market for reconstruction just because they're soft and squishy and they feel like boobs, but they went off the market for anything cosmetically. When they came back on the market, that things were fine. What the FDA did, maybe a year ago, I
Hmm.
think, give or take a
I
little bit,
think the black
is
box label.
created the black box warning, which states a couple of things. So I'll get back to your explant question in a second. Number one is that breast implants are not a lifelong device, meaning they will last for 10, 15 years, and then they probably need to be replaced. Number two, certain patients may not tolerate breast implants. They may not tolerate anything implantable, whether that's an IUD for pregnancy, whether that is tattoo pigment.
Hmm.
They may not tolerate, so they may not tolerate breast implants. So they may develop some breast implant related illnesses, which are fairly a broad range of categories where people just don't feel great. They're tired, generalized fatigue, muscle aches and pain, stuff like that. Or they just don't feel great. Those usually get this ridiculous workup and then finally take out the implants. That's the thing too. And
Yeah.
number three is there is a risk of anaplastic large cell lymphoma or ALCL related to textured breast implants. So we don't do those implants anymore at all, except occasionally for reconstruction for weird reasons. But that being said, they really just don't do it.
Hmm.
So what has happened as more information has been available about breast implant related illnesses and people just not feeling great with implants, people are coming in and have removed. So the question becomes a couple of things. Um, what's going to be the recovery? So it really depends on the size of the implant. So if the implant is teeny tiny, then just take the implants out. You'll have to wear surgical bra with some compression for a bit, depending on your surgeon's preference.
Hmm.
And then and kind of going about your business. However, if you have a gigantic implant, then we're going to have to do something to decrease the seromal cavity or where the implant is. So you'll probably have a drainage tube and your recovery is going to be longer. So it really depends on the size of the implant.
Okay.
There's some people who want their implants removed and have a lift. Once again, it kind of depends on the size of the implant. So smaller implants, it's really easy to do that. Larger implants can be a little bit more troubling because the skin gets stretched out.
Hmm.
But, breast explant surgery has become a lot more popular just as people are being aware of things. And then there's a point where some ladies are saying, hey, these breast implants are kind of heavy. I'm getting older. I just want them out. And that's
Yeah.
perfectly fine. That's the
Again,
same thing. There's a lot of people coming in and say, I want new breast implants or I want bigger or whatever, which is also okay. I
right.
think the thing is meet people where they are. If
Yeah.
someone's coming in my office like, I want my implants out, I'm like, okay. Or if
Yeah.
they come in and say, I want implants, okay. To each their own.
Right. Exactly. And however, respecting wherever that person is at in their journey and however they feel best. Because, like
Yeah.
you said, there's a lot of different options. Another one of the conversations that we've had recently, which was surprising to me, is around breast reduction surgery that is covered by insurance.
Yep.
And I remember you said you're like, it is the top three most life-changing procedures that someone can have.
Right.
But insurance companies, I think people are really thinking insurance companies will cover this, but that might not be the case.
Well, kind of full history. So there was a study done a number of years ago. I think it was out of the Harvard system, but I could be misquoting that. But it was stating that what are the most troublesome chronic diseases which people could have, meaning
Mhm.
what are the things which are the most life altering? Number one was angina or chest pain because you have coronary artery disease. Number three on that list at the time was macromastia or big boobs.
Mhm.
So if you think about it, if you have really, really large boobs, think about carrying a bag of sugar, 5 pounds, in your bra on each side.
Yeah.
So what that does, make sure you get grooves in your shoulders, and you get pain in your neck. So that's really what big breasts do. So 10 years ago, if you had come to my office and said, I want to have a breast reduction, I'm like, okay, insurance will pay for it. I mean, that's
10
just
years
normal.
ago.
10 years ago.
Wow.
If you come into my office now, I'm like, good luck getting insurance to pay for it. I've had one person approved in the past 6 months.
Wow.
So, yeah. And there are criteria listed. Blue Cross Blue Shield of North Carolina has a very comprehensive list. And I don't have any vested interest in Blue Cross, but we give our patients those criteria and say,
Mhm.
if you want insurance to pay for it, this is your checklist. This is your box of stuff which we have to go through.
Yeah.
Once you meet all those criteria, then we'll try to submit it for you. And
Okay.
that's cumbersome to say the least. But that's really the only way to get it paid for.
And that's about a year of the patient having to go to their primary care provider, prove some of these things. I mean, what changed 10 years ago? These were being approved.
It's a great question. I really don't know. I don't know. I wish I had a good answer. I just think they thought they could, so they did. And I think probably what happened is they made the criteria so restrictive is not the word I really want to use, but so restrictive that it's hard for people to jump through all the hoops to do it.
Got it. Well, I mean, this was all extremely valuable, and I think that there's probably going to be a lot of different questions that arise, from the viewers in this too. But I really, really love the points, the 5 questions, reiterating to do your research if you are thinking about plastic or cosmetic surgery. It doesn't harm, it doesn't hurt anything for you to go and get 2, 3 consultations and find somebody that works for you, based on bedside manner and your qualifications. So if you have any other questions, would love to hear from you. I will have a bunch of the links that we mentioned in the description of this. And my last question for you, Dr. Franklin, how can people find you?
So you can go to the website, josephfranklinmd.com, and I'm in Cary, North Carolina, in the Raleigh area of North Carolina, near Morrisville.
Lovely. All right. Thank you, Dr. Franklin. I will
Welcome.
be
Thank you.
chatting with you very soon.